Very good question. Statins are a group of medication which will prevent production of lipids or cholesterol inside our livers. Probably it's interesting to note that the lipid production or the lipids in our bloodstream, in our body, are 80% produced by our own liver, and 80 to 85%, I would say, and 15 to 20% of that is coming from the food that we eat. Then by taking statins, you will stop producing or reduce producing that 80%, 85% of lipids in the liver, then your cholesterol will be lower. As we all know, having high cholesterol has been recognized to increase your cardiovascular risk, means increased risk of heart attack, stroke, peripheral vascular disease, which are quite significant and life limiting conditions. And by producing less cholesterol and reducing their level, by time in coming 10, 20 years after taking or starting the statins, you will have a lower cardiovascular risk, means lower risk of having heart attack, stroke, which is not something anyone wants to happen to them. Unfortunately, all medications in the world will have some side effects. There's no medication without side effects, and statins are not exception as well. Then the common side effects for statins are muscle ache, joint ache, back ache, tinglings of the hands, sometimes tiredness, sometimes upset stomach. These are the most common ones. But the good news is that the incidence or the rate that we may get these side effects are very, very, very low. Then there are maybe billions, if not millions of patients who are taking statins all over the world, and the number of the people who may have these side effects really in a significant level are thousands, and they are not really bad drugs at all, and they are very friendly in their side effect profile, but there are still rare occasions, or sometimes patients will have side effects to them that we can try to choose a different statins or different medication if needed. For reducing cardiovascular risk, one should do different things. Then when you change your lifestyle, when you exercise more, when you eat healthier, when you try to adopt a Greek style cuisine, which is known to be the best so far, you will make your cardiovascular risk less. However, when you start taking statins in addition to all of those measures, then you will reduce your risk even further. Then to answer the question that whether by changing the lifestyle we may not need to take statins, I think that is only applicable to the small group of patients who have got very low cardiovascular risk, and by changing their lifestyle and diet, they can reduce their risks so significantly that statins are not needed. But anyone with moderate or high risk not only has to continue and follow their lifestyle, which is healthier, exercise, and better diet. I think it's at the moment advisable to take statins if they can tolerate it, obviously. Yes, as we explained so far, the reason we take statins is that we want to reduce our cardiovascular risk. Then the first question is that how much is your cardiovascular risk? This is an individual calculation of cardiovascular risk, which we normally use some calculators which are based on some evidence-based research. The most reliable one is called Q-Risk 3. Then when you put the different information about a person, like their age, their gender, where they live, their weight, their height, their cholesterol readings, their blood pressure readings, their family history, any other conditions that they have, which will be asked on that calculator screen, then you will get a calculated risk. If that risk is about 10 or above, it is recommended at the moment in the evidence-based medicine that taking statins, if tolerated, will be beneficial and reduce your risk for coming years, especially the next 10, 20 years for that person. If the risk is less than 10, especially less than 5, we can say waiting and watching way, like surveillance, would be a good idea, and you try to do your healthier lifestyle approach even more, say, carefully or tighter. And if the risk is, I said, 10 or more, 15 or more, especially 20% or more, definitely taking statins will be beneficial to reduce your cardiovascular risk. Yes, there are some evidence, not very strong, but some evidence for some natural remedies. The ones that have got evidence-based research on it are the plant sterols and stenols, we call them. They are some type of plant based, say, chemicals or food related supplements, which can reduce the cholesterol to about 5 to 10%, not more than that. And these are mostly available in soya beans, in some other plants, and there are some commercial products available. I know that they have taken and injected these plant-based compounds into their products, and the main one known in UK is the Benecol yogurt, which you can take one a day, for example, or you try to add soya and soya products in your food daily, and that will produce some effect against the cardiovascular risk, but not more than 5-10% in the best way. They are not really alternative to statins, but for those patients, as we explained, with very low still cardiovascular risk, but still higher than very, very low levels, then maybe taking Benecol yogurt a day or soya beans to reduce the cholesterol to lower than what it is will be beneficial. But I wouldn't say they are alternatives to statins. When statins are needed, they are the best to be taken.